Patients, are you ready?
Yeah.
Okay, you guys ready?
Yes.
Yes.
Also, I'm gonna be talking a lot, so it's not gonna be within 10 minutes, but let's go. Okay. Hello, can I come in?
Yeah, for sure.
Hi, my name is Jen. I'm gonna be your nurse today.
How's it
And good. How are you?
I'm doing well.
Awesome. Okay. I'm gonna just take about 10 minutes of your time just to do a head to toe assessment. Is that okay?
That's what's up.
Perfect. I'm sorry. Can you show me your wristband and tell me your full name and date of birth? You can make one up.
Gilbert Palayo,
Uh-huh.
when March 29th, 1996.
Perfect. Do you have any allergies, Gilbert?
No,
Oh.
that's my knowledge.
Okay, awesome. Just put my gloves on here.
Sure.
Right. So let me move this table out of the way. And start bringing up the bed. Just a few more questions, real quick.
Mm-hmm.
Do you know where you are?
Yeah.
Where is this place?
A hospital?
Perfect. And what's today's date?
The 20th?
Okay. And last question. What's the reason why you're here?
Man, I fell down some stairs.
Okay. All right. So I'll have to see if you have any injuries. Okay.
For sure.
So, noting that the patient is calm and cooperative, he's dressed appropriate for the weather. There's no odor. His skin is
you.
appropriate for ethnicity. The skin that I do see is clean and intact. Okay, skin assessment can be done throughout because you won't see all the skin now. He's alert and oriented times 4, and speech is clear, answers questions appropriately. Perfect. I got a whole bunch of things checked off, right? Okay. So I'm just gonna moving from your head all the way down to your toes, starting with his head. I see that the hair is evenly distributed. It is clean. It's shiny. No
Thank you.
alopecia. Is it okay if I touch your head?
Go ahead.
Okay, perfect. Any pain when I'm touching it?
Nope.
No? Okay. So head is normocephalic, atraumatic, and I don't know if I mentioned no infestation. Okay. Perfect. He's smiling. I can see that his face is symmetric. Okay. Moving down. Let's go to your eyes. Do you wear any contact lenses or glasses?
No.
Okay, perfect. Great vision. I'm jealous.
I had the LASIK
I'm pretty
done, that's why
blind.
weird.
You had LASIK?
Yeah, it's pretty good.
Nice. I might have to do that one day. I'm so
Do
blind.
it. Worth it.
Okay. I can see that his sclera is white, conjunctiva is clear, no injection. Brows are full, eyelashes are there, and I just want to check his eye movement first. So go ahead and keep your head straight and follow my finger with just your eyes. Okay. And I'm tracing it out in a whiskers, or you can also trace it out in H pattern. And I'm just watching his eyes move smoothly to all 6 cardinal points. Just keep following my finger. Very good. And his eyes accommodate to far and near objects. This next part, I'm going to shine a light into your eyes. I'm seeing that his pupils are equal in size, and they're round in shape. They're about 4 millimeters, and let me check to see if they react to light. Okay. So go ahead and look at the far wall there, and I'm going to shine a light briefly into each eye. Perfect. Looking at the direct pupil constriction and then the concentric one. Okay. So same with the other eye. I'm going to look there and then perfect. Okay. So basically perla, right? I checked the light. Perla meaning pupils equal round, react to the light, and I did the accommodation already. Nose is midline, it's symmetric, no nasal flaring that I can see, no lesions. Go ahead and tilt your head back. I'm gonna look right inside your nose, and I can see that the septum's intact, and Mucous membranes are pink, they're moist, no discharge. Okay, I mean nothing coming from his nose. Let's check for patency. Go ahead. Plug one nostril.
What?
Just plug one nostril
Okay.
and just, yeah, over the top. Breathe in. Okay, try the other side. Breathe in. Any trouble breathing through either side? Excuse me. Alright, so nares are patent. That means, it's not, I'm not having concerns about any airflow. Perfect. Done with the nose. That's it. Looking at his mouth. Lips are pink. They're moist. No lesions. And teeth are white. Go ahead and stick out your tongue and say, ah. Okay, perfect. I can see that all the teeth are intact. Okay. And oral mucosa, tongue, gums, they're pink, they're moist, no bleeding of the gums, really healthy looking mouth, basically. Okay.
Thank you.
Go ahead and stick out your tongue again and move it side to side. Okay, cranial nerve 12 is intact. And when he said I did see the uvula rise symmetrically, so cranial nerve 9 and 10 are intact. Okay. I can see he wears no dentures. Do you have any trouble chewing?
No.
Swallowing?
Mm-mm.
Okay, perfect. We're done with now. Okay. Looking at his ears. Turn towards me. I want to see both ears. Okay, perfect. They are symmetric. Colors appropriate for ethnicity. I don't see any piercings at all. No erythema. And let me touch this ear. I'm just look inside. Any pain as I'm palpating your ear?
Nope.
A little bit of cerumen. Little oily, but no redness, no discharge. Okay. Turn towards me. Okay. Same thing. Little oily, minimal amount of cerumen. Anything? Okay. And what else did I say? No erythema. Non-tender to palpation. Okay. Do you wear any hearing aids?
Nope.
Okay. Didn't think so. So go ahead and plug up your left ear, and I'm gonna whisper something. What did I say?
Buttermilk pancakes.
Perfect. Okay, so that ear is all checked off. Go ahead and cover your right ear and let me know what it's
Maple syrup.
Very good. Okay, so I would say gross hearing is intact. We're not doing a full ear, hearing test, but we can tell that his hearing gets by. Okay, no concerns there. Perfect. All right. I gotta move on down to his neck. So, neck-wise, I can see that the trach is midline, skin is clean and intact, and I'm just gonna feel for the lymph nodes. Okay, so this is the pre-auricular right in front of the ears, post-auricular behind the ears, jugular digastric right around the corner of the mandible. The submandibular, submental, okay, cervical chains come down the neck, occipital or right on the back of the head, and go ahead and scrunch your shoulders for me, and then this is the supraclavicular ones. Okay. What am I feeling for? Yeah, so if the lymph nodes are not swollen, what would I feel?
If they're not swollen, there's nothing.
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 Very good. You know your stuff. Okay.
Thank
So,
you.
basically, you're not feeling anything. Okay, so I would say no lymphadenopathy that I could feel. Any pain as I was feeling for them. Non-tender to palpation. Okay. No masses. And he's at a 45-degree angle. So I can check for jugular venous distension. I know someone had asked about that earlier. Patient has to be at, a particular angle. And go ahead and turn your head over to your left liver. And I'm looking for, here it is. You guys want to come close? You do not have jugular venous distension. You see this mild pulsation here. It has to be real high for it to be jugular venous descension. There's a certain measurement. You have to like put a ruler on his sternal angle and then like see how high it goes. His is barely there. You do not have JVD. Okay.
Do you mind doing that again?
Yeah, it's right.
Oh.
Yeah, right there. Just a little pulsation. So that's what we measure. I'll have to show you on your partner later, so you can see too. I'm not requiring you measure JVD on your test out. Basically, I just want you to look. But your book, you do want to look at your book to see how it is measured. Okay, it shows it in one of the figures. Okay. What am I missing on the neck? JVD, massive. Oh, carotids.
Dang, you look a nice one.
It's not too much. I got it from Amazon. Amazon had a sale, and I was able to engrave my name on
It's
it.
everywhere.
Yeah.
Amazon had a sale.
Nice.
Let me make sure it's on the right
Plug
spot. Oh,
Amazon right
there. So, carotids are right next to the trachea. Okay, perfect. I'm listening for any bruies, which are like swishing sounds, and no, there are none. Okay, you would only bruies are abnormal. You would hear them as, let's say, maybe the carotids are really narrowed or something. So I don't hear them. That's good. Actually, I don't need to put this down. We're moving on down to your thorax. Looking at his chest, I could see that the chest rise is symmetric. Okay, and he does not appear to be in any respiratory distress. Respirations are effortless. Skin is clean, it's intact, it's appropriate for ethnicities, there's no chest tubes, no use of accessory muscles. I mean, you don't have to say all that, just pick like 2 things to tell me, okay? Alright, when I'm gonna listen to your lungs. So when you feel the stethoscope touch you, go ahead and take a deep breath in and out, okay?
Okay.
All right. And you want to pace yourself in case they get dizzy because they're breathing so hard. Your book does tell you which spots to assess for breathing. More along on the posterior aspect than the anterior, if you do okay. I would say give me 6 spots on the front. Your book tells you like 20 different spots to listen to, but give me at least 6 spots on the front, evenly spaced, and then 1 on each side. They're nice and clear. Okay, Gilbert, can you like lean forward so I can listen to your back? Same thing, okay? Eight spots on the back. Listening for full inspiration and expiration. So lung sounds are clear in all fields, and no adventitious sounds that I can hear. And while I was on his back, I did notice spine is nice and straight. It's midline, okay? No excessive curvatures, and skin is clean, dry, and intact over the bony prominences. So that gets the back out of the way, okay? That's why I like my order. Get that. So he doesn't have to sit up for me anymore. Awesome. So I'm done listening to your lungs, and I'm just gonna listen to your heart so you can breathe normal. for this next part. Okay. Aortic, pulmonic, tricuspid, and mitral is going to be right down here. Okay. You will, on your test out sheet, it does say you have to listen to the point of maximal impulse, which is right here for 30 seconds. Yes, I will be timing you as you do that, okay? I'm just saving you the time now.
30 seconds total for everything.
No, just a few seconds for everything, and the point of maximal impulse, 60 seconds, sorry. Yeah, I meant 60. So what I'm hearing as I'm going through all those landmarks is the bum bum, bum bum, bum bum. Okay, you should hear this basically the same thing in every landmark you go to. Do you guys know why we're listening to all those spaces if all you're finding is bum bum, bum bum, bum bum?
Then it's in rhythm.
Perfusion.
What does aortic, pulmonic, tricuspid, mitral stand for?
For the valves.
Yeah,
Like opening
uh-huh.
and.
If they were in
yeah.
sync,
yeah.
there would be a problem.
Yeah, so the thing is,
For
if
the systolic and dystolic.
like
breathing.
like let's say there's like certain murmurs or whatnot or narrowings right there, and so there's maybe a particular valve that's not working the way it should. You might hear it better in one spot than the other, okay, because of the way the sound transmits throughout the thorax. Okay, but expected findings is S1, S2 heard. That's the bum bum that I hear. No murmurs, no rubs, no gallops, no clicks. Okay, so none of that extra stuff. His heart sounds real good. Okay. If I were to put my stethoscope on the point of max impulse for 60 seconds, I would be counting the rate and the rhythm. Okay, so maybe something along the lines of heart rate is 75 beats per minute, regular rhythm. Okay, regular rhythm is what I'm expecting. Irregular rhythm is, that's the unexpected. Okay, so regular rhythm, the usual bum 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 pattern. Okay, awesome. How are you doing, Gilbert?
Good.
Okay, let's see, what was I gonna say? You'll notice that my script doesn't have the word good, excellent, normal. I don't want to hear you say the patient's lungs sound good. All right, I want you to use the
Respiration 16.
terms from the book. Yeah, respiration 16. Okay. All right, abdomen. So, abdomen is flat, non-distended. Skin is appropriate for ethnicity. No feeding tubes. It's intact. No scars. Perfect. Okay. After you inspect the abdomen, what's the next step?
Genitalia.
Listen to it.
Listen to it.
Oh, listen
Okay. So, you can't palpate it until you listen to it, because palpating the abdomen can change the sound. Okay. So if you got the order backwards for the abdomen, I have to deduct points. Okay. So listening to it, think of the abdomen as having 4 quadrants. Belly button being the middle of your plus sign. Okay. Only a few seconds per each quadrant, unless you can't hear anything. So. Stuff is moving through.
That's some yogurt.
That's me.
Hi, what?
That's some yogurt.
Oh, well, there it's going. Okay. Very good. So, normal active vowel sounds in all 4 quadrants, okay? I can move on from there. Okay, I'm just gonna palpate. In your book, it goes over light and deep palpation. I only want you to do light on your class, okay? Deep is more like you're looking for organs of, I don't want to be it's harder. He's like, oh. So just let me know if anything hurts, okay? And I'm looking at his face too to make sure that I'm not pushing down too hard. Oh, any pain? You're okay?
I'm good.
Okay. So I'm
Feel
not
good
feeling
spin.
any masses, non-tender tube palpation. Go through all 4 quadrants. Perfect. So we're done with that. Okay. When was your last bowel movement?
Man. In the morning, I think at like 6 or 7.
Perfect. Okay, so you had one today. All right. Soft
6:30.
is regular for you.
Yeah, unnotable.
Okay. Awesome. Okay. Perfect. Moving on to the genitalia. When was your last void?
I think yesterday.
Okay. Well, I
Or
have to,
maybe
you
at
know.
the same time.
I have to, I have to think like, okay, maybe when was, I have to check on that because he hasn't peed in a while. Okay. Any difficulties with that?
Nope.
Okay. I have to keep it more like an open question because I can't ask like, was there any pain, whatnot? Because with some of your older, you're not old enough, but like once you get like older male patients, they have like prostate issues, and they could have issues with starting the stream, like a weak stream. Not feeling like they've emptied their bladder completely. Those are things that could be going through their minds, and so I just keep it any concerns. Any concerns about your genitalia? I should look at the right now.
No. Good
Okay.
work.
So
Are you sure?
just inspecting. It's intact.
It's there.
It's no erythema, no lesions, no discharge. Anus wise, again, no lesions. Okay, and what else can I say? No erythema. Okay, done with that part. We're almost done. Thank you for thank you for your patience, Gilbert. Moving on to his arms. Can you give me your hands? I'm gonna just check your pulses here. So radial
Take my watch
pulses. No, that's fine. I can sit right. Radial pulses are nice and strong, equal bilaterally, and regular rhythm. Okay. Checking for cap refill. Okay. Instantaneous for Turgor. Okay. No tenting. And edema. Okay. You have to press on something bony. Hold it for a few seconds. Then run your hand to see if there's any indentation. And he has no edema. Okay. You're noticing I'm checking both sides. You have to. Okay. If you're missing one side, let's say you only check radial pulses on his left or whatnot, you're missing. You're only getting half the point for that. Okay. Because you have to check both sides of the patient. Okay. What am I missing? Oh. Go ahead and squeeze my fingers as hard as you can. That's it.
I don't want to.
No, go ahead.
Oh,
Very good. Nice and strong. 5 out of 5 strength. And I only give him 2 fingers because if you give him your whole hand, it will hurt. Okay, so just give him 2. So 5 out of 5 strength. Go ahead, keep your arm up in front of you. Don't let me push him down. Okay, don't let me push him up. Yeah, definitely 5 out of 5 strength by the upper extremities. Put your hands in front of you and close your eyes because I'm gonna touch you with my finger. Let me know when you feel me touching you.
Okay. Feel it down. Yep. Yeah.
Okay, good. Sensations intact. Note that I touched like the tips of his fingers, right? So if I had touched here and he felt me, well, I would know sensations intact right here, but what about the other part? So when you test the ends of like the extremities and and he feels it, everything else is intact. Okay. So I just saved myself a bunch of time, like, just go for the ends. If your patient can't feel you, you just move up and then you see where it is that they,
It stops.
yeah, where it is that he starts feeling that, like, patients could have peripheral neuropathy. Okay. Okay, awesome. I think there's one more thing. I know there's 7 things I have to do on the hands. So Turgor, tenting, edema, I think the last thing is just range of motion. Okay. I want you to follow what I do. Go ahead and put your hands up in the air. Okay. Out as far as you can. Okay, give yourself a big hug. Okay, put your hands behind your head, behind your back. Okay, so I'm watching him as I do this. Alright, so go ahead and put your arms in front of you again. And spin your palms around, bend your elbows, okay? Rotate your wrists, open and close your fingers, touch your thumbs to each finger, full range of motion, okay? Awesome. Okay, looking at his feet. Okay. Let me pull these ones off to the side. You can move your feet. Okay. There. Okay. Pulses here. Dorsalis pedis. Posterior tibialis. You got nice pulses. Okay, it's +2, equal bilaterally, regular. Cap refill is instantaneous. There is no edema. Okay, close your eyes. Let me know when I'm touching you.
No. Okay. There. Good. Yep.
Okay, so I'm touching his toes and the bottom of his feet, you know? Okay, so every sensation's intact, basically. What else? Oh, I need to check your strength. Push down on my hands. Push up on my hands. Very good. Muscular strength is a 5 out of 5. Okay. I could check strength too. If you keep this leg up in the air. Don't let me push you down. Don't let me push you up. Okay, same with the other leg. Don't let me push you down. Don't let me push you up. 5 out of 5 strength for sure. Okay. Okay. We're gonna check your range of motion, so go ahead and bend this leg towards your chest. Very good. Now bend it back out. Take my hand from here. Perfect. Same with this leg. Bend it towards your chest. Bend it back out. Kick my hand. Okay. And rotate your ankles. Wiggle your toes. Full range of motion by lower extremity. I think that's it. Okay. Okay. Did I miss anything?
If you did, we don't gotta get tested on, right?
No, you still got it.
Just patient
But oh, you can technically miss four lines. Let me bring it back down. Okay, that concludes my exam. Thank you so much for your time, Mr. Gilbert.
Indeed.
And make sure you're all covered up. Do you have to use the bathroom at all?
Good.
Are you in comfortable position?
Mm-hmm.
Are you in any pain?
Nope.
Okay. It doesn't look like that fall did anything because everything looks great on you. Okay. I see. Oh, your call light's right here. Okay. If you need, let me know. Just your call light.
That's cold.
Here's your hand sanitizer. If you need anything else close to you.
That'll do it.
Okay. You're covered up.
Mm-hmm.
Do you want me to close the door on the way out?
No, it's okay.
Okay. Awesome. And let's see. What else am I doing? What's my trash can? Well, I'm gonna throw this in the trash can. And do you need anything else from me before I go?
Nope. I'll be fine.
Awesome. Okay, perfect. So that concludes it. Thank you for your time.